The nervous system in our brain and spinal cord controls everything we do. It conducts movement and balance, directs touch and reflexes, and manages speech and thought. The building blocks of this system are called neurons, or nerve cells. There are billions of them. Together they form vast networks that pass messages between brain and body, allowing us to function in everyday life. But as we grow older, so too do the cells that govern this system, and over time things can go wrong. In our aging population, more and more of us will be diagnosed with neurodegenerative disorders such as Parkinson's, Alzheimer's, and motor neuron disease. But how much do we really understand? And what does the future hold for their treatment and cure?
All of us unfortunately age, and with age we also lose some of our nerve cells over time.
In Göttingen, Germany, Professor Matthias Bahr is working with patients diagnosed with motor neuron disease, a condition that affects voluntary movement.
If you want to initiate a movement, a certain impulse has to be sent from the brain to the spinal cord, and from the spinal cord to the muscles, which are the executors of the movement. If those connections are somehow disturbed, you get a disorder which affects normal voluntary movements. And this may affect your tongue with the speech, this may affect swallowing, this may affect just normal movements of the hand or of the legs.
Okay, gut. Okay.
Ich heiße Christiane Steingrube. Ja, die Diagnose wurde im Dezember 2005 gestellt. Es begann eigentlich mit einer Kraftlosigkeit oder Kraftminderung in den Armen, Arm-Schulterbereich. Und dann aber auch merkte ich, dass es in den Beinen anfing.
The muscle is kept alive by the impulses which come from the nerve cells. So if you have a muscle which is no longer under the control of the impulse of the nerve cell, then there's also a degeneration of the muscle, a muscle atrophy.
Okay. Jetzt mal versuchen, die Hand so nach oben zu drücken. Ja, okay, gut. Jetzt mal die andere Hand. Genau. Einfach nach oben. Ja, sehr gut. Okay, gut.
Also im häuslichen Bereich, muss ich sagen, bin ich auf Hilfe von meinem Mann angewiesen, der eigentlich alles macht. Ist angefangen vom Anziehen, Toilettengänge, Richten der Nahrung. Also, und selbst jetzt fällt es mir sehr schwer, auch selbstständig zu essen.
So the problem is we do not completely understand what exactly happens in this disease, what is really governing this disease process. There's one drug which is available on the market, and this leads to a little slower progression of the disease, but it cannot stop it.
Preventing brain disorders from progressing is one of the biggest challenges in modern medicine. In Cambridge, England, Professor James Fawcett is coordinating Neurone, a network of scientists from across Europe whose main aim is to find new ways of tackling these diseases.
Science has now become so complicated and so specialised that no scientist, no one group of scientists is ever going to have all the expertise that's required to cure a disease such as Parkinson's disease, motor neuron disease, Alzheimer's disease. And it's only through bringing together multidisciplinary teams that we're ever going to find a treatment.
Neuroscientist Dr. Isabel Weiss is managing the network.
Neurone is a network of excellence that is funded by the European Commission. We have about 200 scientists and clinicians working together from 9 European countries. We have a lot of projects that are based on stem cell research, trying to replace the dying cells by new cells. We have also people doing more academic research, so we organize regular meetings, we organize regular workshops, so that when they work together, it's not only isolated teams working on their own, but actually they're bringing their forces together.
Like other partners in this Neurone Network, we are also engaged in understanding what is really governing this disease process. And for that, we need to look into the nerve cell, what's going on there, how the nerve cell is kept alive, and thereby also have a principal drug or a principal therapy that we can then translate again into a clinical trial with patients.
At the Cambridge Brain Repair Centre, Professor James Fawcett is overseeing research into Parkinson's disease, a condition that affects our coordination.
Well, the two main things that cause patients to seek medical advice are either that they notice a tremor in their hand, usually one hand or the other, or that they start feeling clumsy or unable to move.
My name's Clifford Williams. I was diagnosed in 2004, so it's nearly 5 years now. During the last Gulf War, I went to my GP with a very slight left-hand tremor, which was getting worse and worse.
Not like that.
Trying to pick small coins up was awkward. Or pick a needle up, it's aiming for that spot.
When you want to initiate a motor movement, you start off with what's called the motor cortex, which is the motor part of the brain. But that doesn't connect directly to muscles. It has to go through various junction boxes along the way down. And at each step, there's connections between the nerve cells called synapses. And whether the signals get across those synapses and whether they can affect the next nerve cell down depends on a variety of factors. And one of those factors is the transmitter dopamine, which is the thing that you lose in Parkinson's disease.
Dopamine is a brain chemical that allows messages to travel from one nerve cell to the next. If the levels of dopamine are reduced, the messages simply get blocked, causing us to lose our coordination.
Some patients will just have the tremor and the inability to move. In some patients, their cognition is also affected. And they get Alzheimer-like symptoms and can't think, can't remember things.
Today's Parkinson's patients can expect to be held by current treatments for at least 15 to 20 years. Clifford Williams has been undergoing a relatively new therapy called deep brain stimulation.
Right, in and out. Excellent. Okay. So then I'll switch it off.
Basically, it's having electric pulses sent into your brain, and it's a battery pack in my chest, wired up to 2 probes in my head.
What it's doing is actually cancelling out a loop in the brain that's become overactive. And so that stops the nervous system doing some of the things that it's done mistakenly to try and compensate for Parkinson's disease.
Okay. And so switch you back on again.
A month after the operation, they turned it on. It's like getting a lightheadedness and then a tingling feeling in my left arm and my left leg, and the shaking stopped. It was like magic.
The nervous system in our brain and spinal cord represents one of the most complicated structures in our body. It can have huge implications for our lives when it goes wrong. Yet scientists from research networks, such as Neurone, are taking giant steps in understanding brain disorders. And thanks to modern medicine, the quality of life for many patients has greatly improved. There is real hope that in the future, a cure will be found.